Hello everyone and welcome to Cosmetic Town TV. I'm your host Tara. Today we have something super exciting to show you guys. We are in the office of Dr. Parsa Mohebi right here in Los Angeles, and we are going to teach you guys everything you've ever wanted to know about hair transplants. I'm so excited. Let's go. Thank you so much for joining us. First off, what is a hair transplant?
Well, hair transplant is when we treat baldness with patient's own hair. So we remove hair from certain areas of the body, scalp mostly, that are permanent, that they never lose it, and replant them or implant them into the balding areas.
Is there a particular celebrity that everybody just brings in a picture of and just always wants to look like?
There are a few. So we encourage that for patients to bring their favorite celebrity pictures so we know what exactly they have in mind. Tom Cruise is one of them. Despite his age, his hairline is very solid.
What's the difference between an FUE and an FUT technique?
So the difference is in harvesting the hair. So a strip method is more traditional. We remove a strip of the skin, and under microscope technicians cut it into follicular units, the natural grouping of the hair. That's what we need to transplant. FUE, instead of removing a piece of the skin and closing and suturing it on the back, we remove them under microscope or with robotic method individually. So there's no line of scar, no pain after procedure.
How long do the results of FUE last? Like, is it a lifetime thing? Is it something that's temporary? How does that work?
Well, like any other result of hair transplant, regardless of the type of hair transplant, it should be lifelong as long as the hair is selected and harvested from the permanent zone, the area that we never lose hair.
So what is a typical procedure day like?
The first portion of the procedure, we're going to see him in consultation room, design the hairline, and after we take him to procedure room, and then we start with local anesthesia in front and back of the scalp that makes the entire scalp numb. And then we make small incisions, very tiny holes, that eventually the grafts will be transplanted into those holes. The next thing that we do is remove the grafts under magnification individually from the donor area. Our technicians are sorting them out, counting them, and they're preparing them to be transplanted again. At the end of the procedure, we just inspect the entire area, make sure everything is looking good, make sure there's no gap that needs to be filled, and we clean patient's head, put a bandage on, and patient could be discharged.
Dr. Mohebi, thank you so much for joining us. And to check out more videos like these, check us out on cosmetictown.com.